Welcome to another edition of IHCP Live. My name is Michael Cook, and I'm here today to present a town hall forum on electronic visit verification implementation. This presentation will largely be a repeat of the presentation that we gave at the annual seminar last October, but we felt like it's really beneficial information for both new providers as well as existing providers as we get ready to move into full enforcement of our EVV requirements. As announced in BT 2023-145, we announced full enforcement of electronic visit verification for our personal care services, which will impact claims that were processed between November 15th and December 15th, 2023. This edit will actually be temporarily turned off on December 16th. We're treating this as a trial run for full enforcement, with the final enforcement scheduled to begin in April 2024. And a final announcement will be coming early next year with that final date. We also want to remind providers that EVV for home health remains in post and pay until later in 2024. So again, we'll provide another publication sometime in 2024 when we make that announcement for final enforcement for EVV on home health services. Now, again, we're going to go through a lot of material today. So for providers who have been around for a while and are used to this, a lot of this will be repeat. But for any new providers out there, you'll get a lot of beneficial information to avoid any claim errors related to EVV. Starts with small issues all the way up to larger issues. But we wanted to begin with some common SAN data specific issues around logging on, adding client data, and then adding employee data. One of the first things that providers encounter where they're getting ready to submit EVV data is logging into the SAN data portal in order to capture EVV information. We just like to remind providers of a couple key things. First off, your agency box at the top box, agency STX number, that's going to be used if you're logging in as a state-sponsored SAN data EVV user. Otherwise, you keep that blank if you're a third-party EVV vendor user, or if you're just logging into the SAN data aggregator, you'll keep that box blank to get into the SAN data aggregator. You'll want to use the Remember Me feature for retention of both the STX number as well as your username. And we also remind providers to use the eyeball feature to ensure that your password is correct. Big reason we bring that up is because after 2 failed login attempts, providers need to use the forgot password feature. Early on in implementation, this was a significant hurdle for a lot of providers who forgot their password or were using the wrong password. After 2 attempts, if you do a third wrong attempt, you'll be locked out of the system. You'll have to contact Gainwell Technologies in order to get your login unlocked. So if you can't remember your password or you've gotten it wrong a couple of times, definitely make sure to use that forgot password feature. Now, when you're entering client information, again, as a reminder, none of the member information is transferred over from core into SAN Data's system. So all this information is actually supplied by the provider. Couple key things that we want to remind you: make sure that you're paying attention to the correct payer. This is especially important for home health users as well as providers as we move into our Indiana Pathways for Aging program next year. We have multiple payers now. In addition to IN FSSA, you'll see payers for each one of the MCEs. So make sure whichever payer, whichever source your member is associated with, whether they're with fee-for-service or especially for home health services, if they are using an MCE, make sure that you're selecting the correct payer from the drop-down menu. Also make sure to span the start and stop date to ensure that we're correctly capturing all the information about the member, including the specific services that they're authorized to receive. Another key feature is to add the client address and phone number. And this is going to be critical for verifying that services are provided at the specific location, especially when GPS is utilized. As a key reminder for providers, if a client has more than one address where they receive services, providers are strongly encouraged to add each additional address to the member's record. And that goes for a phone number as well. If a client happens to have more than one phone number, go ahead and add each one of those phone numbers to the client record. And this is critical, again, for capturing correct EVV information and making sure that we avoid an unnecessary amount of exceptions that providers have to clear in order to make sure that that record is considered verified. So if a member happens to be receiving services out in the community somewhere, if there's a dedicated location where they're usually receiving services in addition to the home, go ahead and capture that address so that when you go to clock in and clock out, that address is already on file. No issues around the verifying the EVV record. When you're adding employee information, a couple key reminders for providers. Always want to make sure that you're testing out that the email is entered in correctly as entered into the portal. Make sure that it's spelled correctly and everything is about it is correct, because that will form the username that individual person, caregiver, will use to log in to capture EVV information. You always want to check the mobile user option. This is enabling that person to use mobile visit verification. If you don't check that box, they won't be able to receive their login credentials to actually log into the SanData Mobile Connect application in order to use mobile visit verification. Users must be added as employees if they provide care. And we also want to remind providers to keep the employee files current. So if you happen to have an employee who leaves your agency, make sure to eliminate them from the SanData portal. And if you have new employees, make sure that you get those employees added into the portal as well. So we're going to continue the theme of tackling some common EVV problems. And again, some of these will range from very common sense solutions all the way up to a little bit more complex issues that might need some further investigation. We're going to start by talking about telephonic visit verification. This is intended for use from the phone associated with the client file. So again, getting back to what we talked about a few minutes ago, this is why it's key that if a member happens to have more than one phone number or whatever phone number they're using, make sure that that number is reflected on their member file. Because if you're using telephonic visit verification, the phone call needs to come from a phone number that's associated with the client. We also encourage providers to only use TVV when SanData Mobile Connect is not available. Again, that's mobile visit verification. And you should only use TVV from the client assigned phone number. This phone number can also be a cell phone or it can be a landline. We want to talk about altering EVV records. Records with errors, and when you look into the SanData portal, these records will be indicated as incomplete. Those records must be corrected so that they show up as verified prior to billing for those services. Verified EVV records should not be altered unless there's an error in the data. A couple common examples of errors in the data include if an employee forgot to punch in and they punched out at a later point in time, or if the employee happened to pick the wrong client or the wrong service was listed, those can be corrected and altered. However, we strongly encourage you as a reminder that changing a valid, complete, or correct record creates a false record. Now, the reason we bring that up, if you're clocking in and clocking out and you happen to go back and adjust the clock in and clock out time, it's really only meant as an emergency basis, as these examples indicate. So for instance, if an employee forgot to clock out at the end of the visit, or if they forgot to clock in at the beginning of the visit, you can go back into those records and amend those so that you have the correct clock in and clock out time. However, if you're clocking in at 1:01 in the afternoon and you really want that to be corrected to 1 o'clock because you provided an hour of service and you want to make sure you started on the dot and you ended on the dot, don't do that. You really want to leave that record as is. So if services started at 1:01, leave it at 1:01. And if it ended at 1:59, leave it at 1:59. Some common things around preventing these exceptions and claimed match issues, because this is, and we'll talk about some of these in more detail, but this material is so critical, especially now as we turn on and activate our EVV edits. You want to make sure that you're providing your employees education so that they're capturing these records correctly. You want to enter all those visits that happen to be missing, and ensure that supporting documentation is retained for no less than 7 years in case you get audited for any issues around your EVV activity. You want to review all EVV activity for span date to ensure no exceptions remain on the EVV record. And we also want to remind providers that only supported EVV services should be billed. So let's talk about some common reasons why when you're billing for services, you may see one of these two explanation of benefit or EOB codes. You may see EOB 951 or you may see 952. Both of these are related to EVV activity. Some questions you need to ask yourself if you're seeing 951. Are you reviewing the SAN data aggregator to ensure that there are verified records for the date or dates of service on the claim? If you're using an alternative vendor, did you bill after the vendor submitted the records to the aggregator? Is your vendor up to date on the technical specifications identifying the specific services? Did you select the correct service to be billed against the EVV record? We'll look at some of these in a little bit more detail in just a minute. As far as 952, did you bill at or below the number of units reflected on the EVV records, especially if the billing was over a period of time? So we've got several key claim tips that we're going to review today. The first claim tip is around a mismatch between the EVV record amount and the units billed on the claim due to incomplete records. If you look on the screenshot here, you'll see that for this particular claim, the units billed on the claim were 333 units. In the same set of services in the SAN data aggregator, this particular member only had 130.75 verified units. So because there was this mismatch, whether this was because of incomplete records or because of some other issues that we'll talk about in just a minute, there's a mismatch between what was billed and what was found within the SAN data aggregator. So for this particular issue, if we're assuming that there are exceptions, there are incomplete records that need to be cleared, make sure that you're reviewing those records within the aggregator and clearing any exceptions and verifying the records and unit amounts matching correctly. So let's say there's a mismatch between the EVV record amount and the units billed on the claim. Maybe they're just not enough units. If you see the screenshot on the left, this is in the SAN data aggregator showing a record for a particular visit capturing 20 units of a service. Meanwhile, on the right-hand side, you'll see the claim information that was submitted with units billed of 32. Again, there was a mismatch. Make sure that you're clearing any exceptions and that you're verifying the record and unit amounts match. Now, there's another mismatch of EVV record amount between what was in the record and the units that are billed on the claim. But this issue is because the claim extended beyond a calendar month. So in this claim example, we were looking at dates of service between June 26th of 2022 and July 2nd of 2022. Key thing to remember here is that EVV activity will only match during the same calendar month it's being billed. So if you're billing over a span of time, make sure to stay within the calendar month for billing, and that ensures that any activity that's billed that was performed in June will match the activity that was in the SAN data aggregator in June. Same can be said for the activity for July. This next issue is a specific concern for all of our alternative vendor users. And this is around EVV record updates being performed after a bill has been submitted for payment. So in this case, if you look on the left, this claim was billed on July 20th of 2022. If you look on the right, in the SAN data aggregator, a provider may have reached out wondering why this particular claim denied when they believe they've got verified activity in the aggregator. But if you look in the records in the SAN data aggregator, you'll see that this visit corresponding with this particular member and these dates of this date of service, this record was received on July 25th of 2022. And this has been a common issue that we've seen from a lot of alternative vendors over the past couple of years. Records that are submitted into the aggregator after the point in which they've already been billed to the IHCP. So you need to make sure that your EVV activity is posted into the aggregator prior to billing, and make sure that your alternative vendor uploads data into the aggregator on a regular basis. Another issue that we've seen in the past, and we haven't seen this nearly as much recently, is around the incorrect service selected on the EVV record. And this has really been tricky for residential habilitation in particular. If you look on the screenshot on your left, the claim that was submitted corresponds to T2016 with the U7 and U5 modifier. And in SAN data system, this is actually going to correspond to RH10, which is residential habilitation 35 or less hours. Now, the EVV record chosen was actually RH10 as well. I believe I might have misspoken there. The claim actually showed RH20, which is residential habilitation over 35 hours. The service in the EVV record captured as RH10, residential habilitation 35 or less hours. But really what we want to show here is that you verify that your caregivers are selecting the right service, and almost as crucially, make sure that your alternative vendor is following the technical specifications for service identifications, so that the procedure code and modifier combinations that you select are corresponding to what SAN data system is configured to look for. The order of the modifiers does not matter, but what does matter is the existence of the modifiers. So if this particular service, if it makes a difference, if the U7 or U5 modifier is missing and it changes the service, you want to make sure that your alternative vendor is following those specifications correctly, so that when you go to select the service, you've got the right service. Another tip that we like to provide to providers is to watch out for a high number of manual records, of EVV records being captured. In this particular example, a report was run for 1 month period to show that the vast majority of their records were coming across as manual. Now, this is not something in terms of turning on the edits now and enforcing the EVV requirement. We're not focused too much on the number of manual records, but we always want to remind providers that the creation of manual records, which means for someone who has administrative access on behalf of the agency to actually go back and create a record without a caregiver actually clocking in and clocking out when services are performed. This should only be done on an emergency basis or as a backup basis. If technology wasn't working, if a phone wasn't available, if something happened where an employee just was not able to start or end an EVV visit, we know things happen, and we know there are circumstances where it's not feasible. Providers are allowed to create manual records on an emergency basis, but they really should be treated as emergencies. So, common tip here: only use manual records as an emergency basis or as a last resort. And finally, probably the most common sense tip is, if there are no EVV records uploaded into the SAN data aggregator, whether it's because an employee just didn't capture the records or because an alternative vendor hasn't uploaded them into the aggregator, that means there will be a mismatch between what's in the aggregator and what's been submitted on the claim. So the solution here: make sure that your alternative vendor is submitting records, and make sure that you're verifying your direct care workers are capturing visits as appropriate. So what's our overall message with all of those key tips? You want to review your EVV activity prior to billing, and that is especially crucial now as we are enforcing this requirement. I want to turn our attention to customer care in addition and other ways that you can interact both with SAN data as well as Gainwell technologies to make sure that you are tackling any EVV issues that you might be facing. One source we like to encourage providers to check out is our SAN data Zendesk. This website provides short and easy to understand video instructions for both the SAN data portal as well as the SAN data aggregator. You can sign up with email, and you also have the option to log a ticket and track existing tickets. So if you happen to have any customer issues that need to go directly to SAN data, you're able to log into Zendesk and track those tickets. Gainwell Technologies can also help you out with that, and we'll talk about how you reach out and work through the tier system in just a couple of minutes. Providers should also be using all available resources, and one of the best resources available is the SAN Data Electronic Visit Verification Manual. So any provider who has access to the SAN Data portal, you should be able to scroll down and see at the bottom option, you'll see a selection for online manual, and that will give you detailed instructions on capturing visits, adding employees, adding member information, modifying any information as necessary. A lot of good tips. Same information can also be found through Zendesk and through SAN Data's online portal system. Now we want to talk through some additional pitfalls and some additional information for providers. If you happen to be a provider that has multiple IHCP provider IDs, and this happens to a lot of agencies, we want to remind you that for SAN Data portal users, each IHCP provider ID for each enrolled location providing services must be individually used for each enrolled location. So that means if I have a location in Indianapolis and I also have an enrolled location up in Gary, and I have two separate provider IDs for each one of those separately enrolled locations, I need to make sure that I have a welcome kit for both of those locations. And that any employee out of either one of those locations, employees need to be added to both of those accounts so that when records are captured, they are associated with the billing ID that will bill for those services. So that is critical to remember. And that's equally as important for all of our alternative EVV vendor users as well. When you request credentials for using an alternative EVV vendor, make sure that if you have multiple provider IDs, you include each one of those provider IDs in your request. Now let's talk about claim adjustments. One key thing to remember, and this has been asked before, if you need to go back to adjust or void a claim, it does not impact the EVV record. So if you have you had clean EVV activity, but perhaps you need to go back and make an adjustment to a claim, the EVV record that was there previously will remain there. Now, if you run into a situation where you receive a denial because there weren't enough units supported by the EVV activity, or some of your EVV records weren't submitted in the aggregator in a timely fashion, and you need to go back, void, and replace those claims and adjust those claims, the EVV when you go back to make that adjustment, we will make another call out to the aggregator, and whatever's in the aggregator at that point in time will be used to match for billing purposes. But if the reverse is true, that there's nothing changed on the EVV record side and it's really just updating units or something specific about the claim, whatever was in the aggregator will still be in the aggregator. So that's to say, don't feel like you need to go back to recreate any additional records or modify any records if you have to make adjustments. Now, what if you run into the issue of retroactive notice of action or prior authorization? The information on the NOA or a prior authorization must be entered on the client file. And this is an example where we would support creating manual EVV records. You would do this for any services that are newly covered by a retroactive notice of action or prior authorization. So if you happen to receive a retroactive notice of action where services were performed back in August, you clearly didn't capture EVV activity back in August because this has been retroactively applied. You are allowed to go back and manually create those records to match the services that you performed. We would encourage you in that situation to make notes in the EVV record, whether you're using SANDATA or your third-party solution. Document that this is because of a retroactive NOA. That's just a good means to make sure to cover your bases in the event of any potential audit down the road. How is billing impacted by EVV? This has been a common question as well that we've gotten over time. Billing policies have not changed, and neither have any policies around units or rounding. None of those policies have been affected with the implementation of EVV. So we say that to mean if you're billing on a 15-minute basis, a service that bills on 15-minute increments, you need to make sure that you're performing 8 or more minutes of that service in order to bill at least 1 unit. In addition, any billing guidance that we've published previously around waiver services or home health services will remain as is, not impacted by EVV. We also want to remind providers that services can only be billed after they are performed. And that's been one of the key goals of electronic visit verification, is to ensure reducing fraud, waste, and abuse, and ensure that services are being billed based upon what was performed. So you are not allowed to bill in a month ahead of time before services are being performed. And an important note that we've touched upon already, to minimize any issues with the EVV records, FSSA is requiring billing at increments at no greater than 1 month. And that's, again, to ensure that whatever you bill in a claim is matching the EVV aggregator correctly. Are tasks required to be completed? The EVV record is looking for service code and modifier combinations, not tasks. So as you capture EVV activity, you'll notice that as part of the EVV activity, you have the option of capturing tasks, which essentially gets a level deeper than just what specific service am I performing. I'm actually explaining in further detail what specific task I'm performing within that service. And this is good information to have. And we allow providers to capture that information, and we would encourage it. However, tasks will not impact the overall EVV or record, and we do not require you to include task information. For alternative vendor users, task ID is actually an optional field. How does EVV work with overnight shifts? Employees should still clock in when they arrive and clock out upon finishing an overnight shift. Employees do not need to call in and call out before midnight to create 2 separate EVV records. Provider agencies should continue to bill normally based upon the units that were provided for the overnight shift. How do I get my welcome kit? If you're a brand new provider, or if you happen to be a provider that's existing, but you're opening up a new branch and you need to get that, you've got a new provider ID, you need to get your welcome kit. Want to make sure that you're completing the self-paced EVV training that's available on the Indiana Medicaid provider website. And then you'll email INXIXEVV@Gainwell Technologies. You'll include your IHCP provider ID for each IHCP enrolled location that you need your welcome kit for. And you'll also include a certificate of completion that you get from completing your self-paced training. Now, how do I navigate SANDATA's customer care? Kind of alluded to this a few minutes ago. There's a couple paths here you need to remember. If you're a state-sponsored EVV solution user, There are 3 tiers that SanData and Gainwell Technologies offer for customer support. Tier 1 is actually calling Gainwell Technologies through the IHCP help desk at the phone number that you see on your screen. And they'll help you with basic navigation like adding users, unlocking your account, basic functionality. If you're unfamiliar with, you're just a brand new user and you're unfamiliar with capturing EVV activity, they can walk you through that step. But if you happen to need some more technical assistance, that's what tier 2 is going to be used for. And that's actually getting into SanData's customer care. So Gainwell Technologies will provide a warm handoff, getting you access to SanData's customer care if there's more technical issues. There's an additional tier 3 that is not available to agencies, but if you happen to have a more complex technical issue, and this is especially pertinent for alternative vendors, SanData has the opportunity to actually escalate an issue up to that tier 3 to get a little bit more technical support. Now, if you are an alternative EVV solution user, we always want to encourage you to contact your vendor first to work through any particular issues, whether that's around technical specifications or just records getting into the aggregator. Best place to start is to talk to that vendor. But then if you need to contact SanData from there, we encourage you to use IN-ALT-EVV@sandata.com, and that will open up a service ticket directly to the team within SanData assigned for alternative vendors. If you happen to not be getting a response from SanData customer care, or if it's taking a little bit too long, you should send an email to INXIXEVV@gainwelltechnologies.com and include your customer care ticket number. And we'll make sure to watch out. We'll follow up with SanData to make sure that we get your issue addressed. Key tip about this to remember is to make sure to watch for communications that may go into your spam folder so that you don't miss an important communication update from SanData. Now let's talk about some specific questions that alternative vendors might have, and users for that matter. How long should it take to receive my production credentials, and what exactly is the process? So we talked about getting your welcome kit through the email address earlier for SanData users. So how about for alternative vendor users? If your vendor has passed testing with an agency in Indiana already, this request usually takes just a few days upon receipt once that gets submitted to SanData. If your vendor has not passed testing, that request will depend upon how long it takes for your vendor to complete testing. So if it's a brand new vendor just coming in, it does need to go through a bit of a rigorous test process with SanData. This does require communication from both the vendor and the agency and SanData. As far as the process for receiving alternative EVV vendor credentials, you'll start off by sending a quick email to evv@fssa.in.gov. And we'll take a look at the vendor that you've selected to to either indicate that this is a vendor that's already tested with an agency in Indiana, or if it's not, we may give you some additional information. But once we've done that step, we'll actually forward you a quick form that we'd like you to fill out, and you'll be able to provide your provider ID or IDs if you have multiple locations, your vendor information, your contact information. From there, SanData will receive that information, and they'll be reaching out to your EVV vendor solution. Your vendor will receive a small survey of 3 to 7 questions. SanData will confirm receipt of those survey details, and they'll create and send testing credentials and testing certification checklist. So this stuff is a little bit more complicated depending upon where your vendor is at in terms of integration with SanData's system. If most of our vendors are already integrated and are in good shape, you'll get your credentials much quicker. Again, if it's a brand new vendor, it will take additional time due to the testing requirements. So what should you do if you're not seeing your visits in the SanData aggregator? Again, best place to start is to contact your vendor to make sure if they can identify any technical issues, and if after exhausting that means, then you would follow up with SAN data through the IN alt EVV email address that we talked about a minute ago. So let's cover some additional EVV resources that are available to providers. Providers have access to our EVV webpage that's located under the Indiana Medicaid provider website under the Business Transactions tab. And that'll give you all the ins and outs of policy related to EVV implementation. All the guidance that we published, the instructions on getting your welcome kit, whether as a SAN data state sponsor solution user or as an alternative vendor user. You'll also have FAQs and other key information that will help you out. You'll also be able to see our EVV preparation guide that provides key requirements, step-by-step guide for implementation, and contact information for questions or other issues related to EVV. And this is also available on the Indiana Medicaid EVV webpage. We like to conclude our webinars by reminding providers of additional provider resources that are available. All providers have access to regional field consultants. Those are the individuals that are located throughout the state of Indiana that can help address billing questions and prior authorization concerns and provider enrollment inquiries. They are really the field staff and the first line of defense if you happen to have a claim denial. And in this case, they will be a great resource to contact as you work through any questions that you have around why a claim might have denied because of EVV activity. We also publish provider reference materials. Those are our provider reference modules that provide the ins and outs of policy related to the Indiana Medicaid program. And we also provide webinars like today's IHCP Live Town Hall and our monthly webinar series to go through all the latest announcements that are provided through the IHCP. You can sign up to be notified of any updates to our publications. And all you have to do is go to the Indiana Medicaid provider website, scroll down and find a little box where you provide your email address, and you'll be given a weekly notification of all the bulletins that come out, any changes to our provider reference materials, and any news and announcements that we issue that previous week. As you're navigating any concerns around EVV, you've got, again, several resources that you can turn to for questions. You can send any policy-specific questions, or if you're getting started with an alternative EVV vendor, you can send those inquiries to evv@fssa.in.gov. If you're looking to receive your state-sponsored solution welcome kit or get some general EVV education, or you just have general issues around claim denials, or you want a virtual meeting to discuss EVV activity, you can reach out to schedule some time through inxixevv@gainwelltechnologies.com. If you're looking to get technical assistance using the SAN data state-sponsored solution, or as an alternative way of looking at claims issues related to EVV activity, you can call the IHCP help desk at 800-457-4584, option 5. I spoke about the provider relations field consultants. You can find the contact information, including the email addresses and phone numbers for all of those individuals on the IHCP provider webpage. With that, we'll take a quick pause to see if there are additional questions in the chat that we can address. Hold tight as we review the questions. There's been a question, can we get a copy of the slides? We will be posting a copy of the presentation to the IHCP Live webpage. That should happen sometime later this week. We had a question, are you aware of agencies that are having continual trouble accessing visits when in the field? If the individual is still on who posed that question, if you have any further details, that would be helpful. Is there a hard launch date set for personal care services, aside from the November 15th, December 15th temporary enforcement? That date will be in April 2024. We don't have the exact date just yet, but we are targeting April of 2024. When did the aggregator switch from rounding clock in, clock out times to rounding duration? Be interested to see if you've got an example record, please feel free to send that to the evv@fssa.in.gov inbox. We're not aware of any changes that have occurred around rounding the visit duration through the aggregator. So I'm not familiar with any change there, but if you've got any examples we can look at, certainly take a look at those. Is there a way to sync manual invoices into SANdata? There was a week that I had to create a manual invoice and it is denied on the Medicaid portal due to the 951 no matching EVV data found. So yes, there is, again, provider agencies do have the ability to create manual records in the event that if there was a technical issue, or if a caregiver just completely forgot to capture the clock in and clock out and start an EVV visit or end an EVV visit, whoever has the agency administrative rights on behalf of the provider agency, they do have the ability to go in and create a manual visit. Do visits have to be confirmed by the caregiver in order for the visit to be verified? No. So the visit is considered verified as long as it meets the requirements of the 21st Century Cures Act. So that record needs to include the person who provided the service, who is receiving the service itself, the date, and the time and location of the service. So essentially, if a caregiver clocks in and clocks out, that should be it. That should be able to capture the person who provided the service, who received the service, the date, time, location. All of that is captured, and the visit would be considered verified. Now, there is the option that a caregiver could ask a member to provide a written or verbal signature authorizing that the service was performed. That's not a requirement, however. But once a caregiver has clocked in and clocked out, assuming there are no exceptions that need to be cleared, caregiver does not need to verify anything for that visit to be considered verified. I have several times been told that some billings are not on SANdata. However, when I go back and check that they are there, why would this be? Wendy, I'm not, you might need to provide a little bit more detail to that question. We can come back to you. Will our third-party vendor adjust time going to SANdata? Causes denials. Say the bottom line there is we want to make sure that from an alternative vendor, the aggregator is receiving those visits and that they are considered in verified status. So as long as that record is containing, again, those key elements that we're looking for, the person who's receiving the service, who rendered the service, the date, time, location, it's considered verified. It's not the claims matching system won't be looking at adjusted times. If you're providing any adjusted times, that may impact the number of units that the record is associated with within the aggregator, but just adjusting the time should not be causing denials. Is this webinar available for print for future use? Yes, we'll be providing a copy of the recording. We'll check to see if we can actually put a copy of the slides on the website as well, if that would be helpful. We're attempting to be a SAN data aggregator. We're in the testing phase, and there are 104 SAN data test scenarios. We've completed 24 of them, but many of the remaining test scenarios can't be done because our EMR vendor cannot process and send the data in the format requested by SAN data. For example, SAN data wants us to send a null business entity Medicaid identifier, but our EMR vendor prevents us from sending this kind of data. Will SAN data approve us and give us our aggregator login, even if we cannot pass at the testing scenarios? That's kind of tough to say. I would say that's probably a discussion to continue to have between you as the vendor and SAN data. I don't believe they would pass a vendor if they cannot pass the testing requirements, but that if you'd like for the state to follow up with SAN data a little bit further on that, please feel free to send an email to the EVV inbox that we talked about previously. We can follow up with you on that. Sometimes after filing a claim, it is accepted by Medicaid for payment, but on SAN data, it does not go from verified to processed. That's a great question, or that's a great comment. So before we had our EVV enforcement, our claim system was configured to be in post and pay. So that means regardless of EVV activity, whether it was there, not, correct or not, claims were continuing to pay. Sometimes when there's verified activity, provider bills correctly, there's verified activity, it does not go from verified to process, which is what you want. You want it to be good to go to processed. That could be a number of reasons. And I think the most likely reason gets down to records that were submitted into the aggregator after the claim has been billed. So in many cases, provider could have verified activity, that's legitimate verified activity, but if it was submitted into the aggregator, even just a day after a claim was submitted to the IHCP, that record or series of records would still be considered verified and would not be processed. It goes to processed if it can make a successful link between the information that was submitted on the claim, matching the member, the service, and the date of service and the agency to activity within the aggregator at that point in time. So if there's any kind of a mismatch, whether the data is not there or whether there are too few units within the SAN data aggregator compared to what you're billing, those records will continue to look verified and not processed. But if you're seeing processed, that's what you want. That means that there's been a completely successful match and you're in good shape. When will the date be set for home health enforcement? That'll likely be in Q1 of 2024. We'll set that date. We're targeting sometime next summer for final enforcement, but we'll make a final determination early next year. Our EMR vendor is Epic, and I don't think Epic has completed testing for the first time. Can you tell me who SAN data is working with at Epic and how far they are with their testing validation? Unfortunately, I don't have that information, but the state can follow up with SAN data. If you'd like to follow up, if you send us your information to our EVV inbox, we can follow up with SAN data on your testing with Epic to see exactly who they're working with. If the client refuses to provide an electronic signature or an audio note at the end of the visit to verify services were rendered, will that cause an issue with EVV or billing? No. This is optional. This is good information to have, and we strongly encourage you to get member validation, but we are not enforcing that as part of this requirement. What happens when your individual lives in a rural area and staff are not able to access Wi-Fi or the internet? I can only speak to the SANDATA state sponsor solution. Don't know about our third-party vendors, but the SANDATA solution, if you lack Wi-Fi or lack an internet connection, you can still capture that information. If you go into an area where there's not a good internet connectivity or GPS information, you can still log that information, and when you come back into getting internet access, that information will be uploaded into the aggregator. If you don't have mobile visit verification available at all, you should be using telephonic visit verification. So you capturing the visit through the member's phone line. If our caregiver forgot to clock in or out, is a written timesheet required to be on file if we adjust the time in the office? No. This is electronic visit verification. So we do not require any written timesheet as part of this process. What we would require in this case, whoever has administrative access on behalf of the agency would log into the SANDATA portal, would find the record in question, and there'll be a specific section where you are acknowledging that you are clearing an exception. So in this case, person forgot to clock in or clock out. You as the agency administrator or whoever has access is acknowledging that you are claiming an exception for this visit, and the visit will then be considered verified and you can go forth and bill. Are waiver service providers able to bill while hospice codes are showing up in eligibility? Also, when MRT codes are also only is present. We have been receiving denials when either MRT, MRO, or hospice are present and there's active waiver. That might be an issue outside of EVV. I think I would probably encourage you to follow up with your IHCP provider field consultant on that particular issue. If you've got some claim denials related to members with MRT or MRO or hospice, those are probably the best individuals to talk to about those claim issues. I've received a letter stating that I'm missing several paid claims on the EVV system, and when I go back and reference the claim numbers that are cited on the letter, I find the information on SANDATA that matches the claim. And in some cases, I have more units provided than I have billed for. It's tough to draw too many conclusions from that, other than could be the issue that I talked about previously. If you're using a third-party solution, perhaps claims were submitted and records were submitted sometime afterwards. So when you check the aggregator now, you can see the activity and it's verified in good shape, but it wasn't submitted at the point in which the claim was submitted. Could be that, could be something else. If you'd like us to follow up with any further research, go ahead and shoot us an email to the EVV inbox and we'll take a look at it for you. Can I give a manual call for a caregiver if she indicates that she's made it to the client and calls on the client phone to say she left her phone or that it is died? So in this case, made it to the client and calls on the client's phone. If you've made it to the client and you are using the client's phone, you can use telephonic visit verification, and that's you're calling a specific number that's given to your agency, and you're following a series of prompts, capturing the service, who's delivering the service, a couple additional prompts, and completing that phone call at both the beginning of the visit and the end of the visit will satisfy the requirement. Is it still January 1st, 2024? January 1st, 2024 is the requirement date for home health services. So that is the day in which our good faith effort exemption for home health expires. So similar to how we've done personal care services, anything provided after January 1st is subject to recoupment on the home health side. We will continue to be in post and pay for a foreseeable amount of time in the future for home health services. But any activity after January 1st is subject to post-payment recoupment. Are you saying client verified and tasks are not required by Medicaid for proper SAN data entry for payment for visit? Client verified is optional, tasks are optional. Neither one are required as part of the matching process for EVV for payment purposes. Got about time for maybe a couple more. In our area of the app, it kicks us out or does not let us sign in to at all when service is poor. Most patients have cell phones, are using TV now, so using TVV is not an option. Couple things, if the app should not be kicking you out as far as poor service reception, but if it is, that's definitely something to open up. We probably encourage you to call Gamewell Technologies Tier 1 support to alert them that you're having that issue. They can help escalate that or review it with SAN data if necessary. As far as patients or members having cell phones are allowed to be used for TVV. So whether that's cell phone or landline, either one is acceptable for telephonic visit verification. If a client denies use of their personal phone and the mobile visit app is not available, is a manual record acceptable as long as it's noted that this was the reason? I think we've gotten this question before, and again, manual visits should really be done as a last means effort. So it should not be a fallback for client doesn't have a phone, it's never available, and the caregiver doesn't have a cell phone to use mobile visit verification. So while a manual visit might be used sparingly in that situation, we really, for the spirit of meeting the requirement, you need to find one of those means. Or if you happen to find an alternative vendor that has fixed visit verification as an option, that's an option to explore. But I would not encourage you to fall back on creating manual visits just because at all times, just because a caregiver doesn't have a phone and a client doesn't have the phone to use TVV as well. Where can I check to make sure that the correct codes are being used for the claims being processed? When you log into the SAN data aggregator, and you're looking at the visits, it will give you a description of the specific visit that's associated with that record. You can find a resource that has been posted to the Indiana Medicaid webpage, the provider website, that actually lists those descriptions along with the specific procedure code modifier combinations that are matched up correctly. That'll be part of the technical specifications. So if you have any questions, you can look to that resource on the Medicaid website to make sure you've got the right service. Got time for maybe couple more. I missed the address for the EVV inbox. Can you put it in the chat? It is evv@fssa.in.gov. I put that into the chat. Take this one last one, nearly out of time. If a client's visit starts or ends at a location other than their home, how will this affect EVV records? I typically will unlock the GPS requirements so the employee can still clock in and clock out, and I make them explain in their caregiving notes why they're starting or ending at a visit at an unusual location. However, I'm not always adding this location to the client profile if it's not a location they'll be using on an ongoing basis. If it's a one-time random visit, Minute Clinic, makes sense. I'm not adding that address to the profile. Is that okay? Should we ensure that the EVV date is verified? What's the best practice when starting or ending a visit outside their normal residence? Perfectly reasonable question. So what's going to happen here? If you're capturing it at an unusual location, it's not usually a typical location in which that member would be receiving services. You will trigger the visit to be considered incomplete, because if your vendor is enforcing the GPS requirement, it will trigger an exception, asking for an exception based upon you have captured a GPS location that's not associated with the member. You'll have to log into your portal solution, clear that exception, and it will be considered verified. In SanData's solution, we've turned off that requirement because of some issues early on around GPS and location matching. What I would say for best practices is if it's a common location that the person could be going to other than the member's home, definitely get that added to their profile. That's the easiest way. If it's a situation like this and it's a one-off basis, just go ahead and clear the exception. Make sure that you are capturing it through GPS. You've got the location, clear that exception, let the record become verified. Maybe make a note within the EVV record just for auditing purposes that this is the reason why we clocked it at Minute Clinic or whatever location it is. That's perfectly reasonable, and you'll be fine. Okay, well, with that, I think we'll go ahead and wrap this up. Thank you all for all the questions. Hope you found the material helpful. We will be posting a recording of the presentation on the IHCP Live webpage in the coming days. We'll also be repeating this presentation in 2 or 3 weeks, I believe. Should be in about the middle of December. So if you'd like to hear this again, or if you had a question that maybe wasn't addressed and you'd like to get another opportunity to ask it, please feel free to jump on then. And as always, if you want to check out any additional webinars, we do post those on the IHCP provider website through our news and announcements. But until next time, hope you all take care and have a great rest of your day. Thank you so much.